So to me, being a family doctor is the best job on earth. Being able to accompany our patients through the ups and downs of their health and their lives and contribute in some way to smoothing out some of those experiences for them is incredibly rewarding. It's a real privilege. DFCM's been part of my journey through my entire medical career. I really was hatched from this department. I did my residency training in the DFCM, and it was clear to me that a career in academic family medicine was the right step for me, and I've been really lucky to be able to evolve my career over time within our department, from practicing rural medicine through the Rural Northern Initiative to becoming a staff physician here at Women's College Hospital, my academic and advocacy work, and subsequently my career in administration. All of that has been within the DFCM, and so I think one of the great strengths, the many great strengths of this department is the way that it allows each of us to find our path and evolve our careers over time in the ways that are right for us and that make a contribution to the whole. One of my favorite things about the DFCM has always been the incredible mentorship and mutual support that our faculty members give one another and give our trainees. And I've really been the beneficiary of that support at many important junctures in my career. When I think back to my preceptors at St. Mike's when I was doing my own training and the ways that they helped and supported me to become a competent family physician, during the time that Dr. Wilson was chair of the department and helped to establish the Rural Northern Initiative, which was a program that I was very engaged in and that allowed us to give back to our rural and northern communities in the province. To all of the folks here at Women's College Hospital who've, in a wide variety of ways, been examples to me of the kinds of policy and advocacy work I want to do in my own career. It's just a bunch of gems, of people and who really genuinely want to support one another. I think that that's very special. I think that as a Department of Academic Family Medicine, our contributions to patient care, stem from our commitment to actually providing clinical care on the ground, and we should never underestimate the importance of the hundreds of thousands of patient visits that our staff and trainees, as well as our interprofessional colleagues on our teams do every year. But that's not enough. A Department of Academic Family Medicine also needs to be contributing to the growth of scholarship and to the mission of the university. And I think that we've come a long way in that regard, where we've really become a leading academically productive department. And I know that Dr. Kidd has really played an amazing leadership role in also encouraging us to become more socially accountable. And I think that's where the next frontier really is to ask ourselves those hard questions about how we can live up to our social accountability mission, something which I know we're all very excited to be able to do. I think that we all know that our healthcare system is in need of change and modernization to meet the changing needs of the populations that we serve. And primary care in general and family medicine specifically is going to have to change to meet those needs. I think we're looking at much more intensity in the care that's going to be required of our patients in the community. And probably sitting in our offices and waiting for people to come to us is increasingly going to be a thing of the past. We're going to need to be reaching out to our patients in their homes. We're going to need to be, visiting with them virtually. We're going to need to be partnering with home care teams and specialist teams in order to support people living in their homes with complex chronic disease. And we're going to need to be increasingly accountable, I think, for the quality of care that we provide and for supporting our patients in keeping them out of hospital for things that, that shouldn't require an emergency department visit or a hospital admission. And I think we can be leaders in that at the DFCM, thinking about our both our academic mission and our social accountability mission, that we can really lead the way in figuring out what those new models of care should look like, and figure out how to do it in ways that support our patients and also the well-being of our providers.